So, in fact, you have already touched on research, and you have more than 300 papers in your name in various medical journals. So, sir, if you can highlight on the various frontiers we have achieved in terms of research on managing diabetes and the identification of the various factors which leads to diabetes.
So some of the factors I have
Yeah.
already listed are those factors like obesity and all those 7-8 things that I have listed will lead to diabetes. But still there are some people who may be thin still and they may not be obese and they still may be highly prone to diabetes. Who are these people? Who have family history of diabetes. So simple to ask a person, well, your mother, father or brother have diabetes? If so, they are at a very high risk even if they are thin. So that is a certain factor which should be asked in every person. Now, if we catch a person like this and do the blood glucose and find that this person is having slightly elevated sugar, not exactly diabetes, but pre-diabetes, that is a very important condition because that's where we should catch most of the people and prevent diabetes from happening. Ideally before that, before development of pre-diabetes, but certainly at pre-diabetes. And if a person, Indian person has pre-diabetes, he rapidly converts to diabetes as compared to a white person or a black person somewhere outside India. So we have a high propensity of conversion to diabetes. And so we have to diagnose diabetes, as you rightly said, catch diabetes early, and the Indian government at this point of time says that everybody over 30 years of age should be screened for diabetes.
Okay. So, coming back to that pre-diabetes phase, we generally know that diabetes is not curable. So, can we, if we identify somebody at a pre-diabetes stage, is it possible to cure him completely?
Oh yes. Now those days are gone when we used to say it is incurable. That incurable word for first couple of years of diabetes is no longer applied because of several research papers which have come recently. So pre-diabetes can be reversed very well with the right kind of diet and exercise, and especially in people who are obese. So say for example, a person who is 110 kg and with a fasting sugar of 110, a post glucose sugar of 170, 80, which is not exactly in diabetes range, if this person reduces 15 kg of weight, he will reverse his diabetes.
Oh, very good.
Plus, if he reduces less than that, say 5 to 7% of his body weight, over 1 year or 2 years, he will still be able to reverse his pre-diabetes. Even if this person develops diabetes, we can still reverse it by losing weight. Problem comes when the person is not obese.
Right.
Then we cannot do much as far as weight is concerned. How this concept has been reversed in recent years is by advent of the bariatric surgery. So people who are 110, 120 kg of weight, they underwent massive weight reduction with a bariatric surgery and their diabetes was totally reversed. Not a single drug needed where multiple drugs were needed. But this can happen only if the diabetes is not very old, something like 2, 3, 4 years of, and certainly in pre-diabetes stage.
So, if somebody is identified as a person who is diabetic, so what are the precautions that person needs to take other than the standard jogging in the morning, or I mean the physical part of it and the food part of it? What are the other things that the person should do?
If you come to my office, I have something written at the back, say knowledge and discipline, and you will overcome diabetes. A person should have enough knowledge about diabetes, because those people who are badly managed are the ones who don't know. So it's our job to educate them. So first thing is, right when it is diagnosed, they should know at least basics of diabetes and what it can lead to. And discipline, then discipline in, you said jogging, walking, diet, and medicines, whatever medicines are prescribed, and the sugar monitoring. If these things are done, at least half the job is done. Then they have to get checked for the basic complications. So there are some very simple tests which tell us early damages.
Right.
Very simple test. So people think, oh, I'll spend thousands of rupees for detecting with a complication. No, very simple. Say maybe 500 rupees, maybe 600 rupees. Just a urine examination, just nerve testing and eye testing. Three things will detect any damages, and those damages in early stages we can contain. So the knowledge, discipline, regular follow-up and regular checkup for